So open enrollment is the time of year when you can make changes to your benefits plans. Are some additional reminders. Open enrollment elections must be made starting on August the 12th and must be completed by August the 26th. The biggest thing to remember is if you're not making any changes, you don't need to do anything. Your current benefit elections will continue with one exception, and that's flex spending. You must re-enroll in that plan every single year. Lastly, if you're going to make any changes with your AFLAC plans or enroll in a plan, you must meet with the rep, and he will be here at the city on August the 20th, 21st, and 22nd to complete their enrollment form. Here are a few more reminders. If you're making changes, please look at the deductions on your first paycheck in October. And if you need any assistance or have any benefits questions, Brooke, Alana, and I are available in HR to help you. Changes to your insurance elections are done using employee self-services. A tutorial is available on the HR Benefits Open Enrollment page. Good news is there's no changes to any of our carriers. The Standard is the company that handles the city's life insurance. WageWorks handles the flex spending plan. Health Advocate is the city's EAP, and Health Equity is the financial account where you would keep your health savings account dollars at. So the city has two tiers as far as the different plans, as far as coverage. So there's an employee only, or once you add one more dependent, you have the family contribution or premium. These are the monthly premiums for Florida Blue, for the HMO plan, the PPO plan, and the high deductible health plan. And just as a reminder, if you do have a premium for family coverage, it's taken from 24 paychecks, not 26. So the first plan I'll be reviewing today is the medical insurance, which is offered through Florida Blue. So here is a brief comparison of the HMO plan and the PPO plans. In the HMO plan, you must pick a primary care physician and you need to stay in the network. The network includes the entire state of Florida. And each family member in the HMO plan would pick a primary care physician, so every family member can have their own. And if you do not like your primary care physician, you can change that on a monthly basis. You do have coverage for emergency medical conditions when traveling out of state in the HMO plan. You can go see any specialist in the HMO plan without a referral, with one exception. You do need a referral for an ophthalmologist specialist. Otherwise, again, you can go to any specialist you want to without a referral. As far as the PPO plan, it lets you stay in network and go out of network. You'll see in the out of network benefits, there is a $500 deductible. After you've met that $500 deductible under the co-insurance line, you are responsible for 40% of the remaining benefit. But please remember, if a provider is not in the network, they don't have a contract, and you would be subject to balance billing. That means the provider can charge you whatever they want to for that service, and Florida Blue is only going to pay them what's reasonable and customary, and you, the consumer, will be paying the difference. That's what balance billing is. So in the PPO plan, there are no referrals either, and you can go in or out of network. It's always much better to stay in network. The high deductible health plan is similar to a PPO plan with access to the same network of physicians. You must meet the annual deductible, then everything else is paid at 100%. Preventative care like mammograms, well woman services, routine colonoscopies, and prostate exams are covered at 100%. You pay the contracted rate for services when you stay in network. So it's not the $15 copay for doctor's visits, or the $5 copay for scripts, or the $250 copay for hospitalization like in the PPO plan. It's actually the contracted rate. You can go on Florida Blue's website and actually find the cost of these services, such as prescriptions. The high deductible health plan is a good choice for healthy family members that hardly use the insurance, or for the person who may not be as healthy, who may meet the deductible during the early part of the year, and then the rest of the year, once the deductible is met, you have no other expense. Florida Blue's website provides you with the ability to access forms and make needed changes to your account. In addition, the nurse hotline is available 24/7 for questions ranging from common symptoms and illnesses, children's health and diagnostic testing, and heart conditions. Care consultants are there to help you understand your condition and to help you explore treatment options. And Blue Care 365 provides members with access to a wide range of savings and discounts from financial health, fitness, healthy eating, lifestyle, vision correction, and hearing products, just to name a few. Their Healthy Edition programs provide prenatal education for expectant moms. So I want to spend a little time talking about health savings accounts. An HSA is a retirement strategy offering a triple tax benefit. Contributions are made pre-tax, earnings and interest on your investments are tax-free, and withdrawals for qualified medical expenses are also tax-free. It's one of the most powerful investment tools available. Just like your 457 or your IRA, you can invest money held in your HSA for maximum growth. HSA accounts are available for those participating in the high deductible health plan only. Most of us know that we need to plan to save money for retirement, and that's why we put money in the 457 deferred compensation plan. When you take money out of your 401k plan or your 457 plan, your withdrawals are taxed. With health care being one of the biggest expenses most individuals face during retirement, saving money in your HSA account first makes the most sense, as it's the only plan that offers you a unique triple tax benefit. Think of an HSA as a 457 for your health care. Distributions are tax-free for qualified medical expenses such as your medical, your dental, your vision, your hearing, and your prescription expenses. So I want to do a premium comparison between the PPO plan and the high deductible plan, since they both have the same network physicians. So the PPO plan, as far as family coverage, is $220 a month, and the high deductible plan is $60 a month. That's $160 difference. And if you take that on an annual basis, that's $1,920 that you're paying more to have the PPO plan than you would have in that high deductible plan. What I'm suggesting is that you take that difference, the $1,920, and put that into your health savings account to help you meet that deductible. So I want to compare the PPO plan to the high deductible health plan. The difference in the premium cost, as I just showed you on the prior slide, for family coverage is $1,920. So the city also makes a monthly contribution into your health savings account. The monthly contribution for single coverage is $59.58, which is just over $714 annually. And for family coverage, the monthly contribution the city makes into your health savings account is $115.33, which is just over $1,383 annually. So if you add your savings and the city's contribution together, the remaining deductible is just under $700. So that is $3,300 free dollars that you could be putting into your health savings account. You can actually put more money into your health savings account. Here are the maximums set by the IRS for the year 2020. So let's talk about some advantages of the health savings account. In addition to the advantages listed here, at age 65, you can use the money in your HSA for any expense without paying a penalty. Non-qualified withdrawals are taxable, but so are withdrawals from your 457 or your 401k retirement accounts. The money in your HSA can be used to pay for Medicare Parts B, D, and Medicare Advantage premiums. You can pay for your long-term care insurance with your HSA dollars, and having tax-free funds available to pay for medical costs as opposed to using taxable IRA or 457 distributions can make a huge difference for retirees. And retirement is a qualifying event, and what that means is you can switch accounts from a high deductible health plan to a PPO or an HMO where you're going to have your known set copays, and you do not have to meet that higher deductible. So there are disadvantages to a high deductible health plan. You do have the higher deductible. You have a 20% tax penalty plus taxes if used for non-medical expenses. You do need to keep good records and keep receipts. You can't be covered by an additional health insurance plan. You have to be covered under a high deductible health plan in order to contribute to your health savings account. You can't have both an HSA, health savings account, and a flexible spending account. Also, it may be difficult to come up with money to meet the deductible in the very first year, and illnesses are unpredictable and they may be hard to budget for healthcare expenses. You can contribute pre-tax dollars to pay for your medical care. Funds can be invested in different stocks and earn tax-free interest. When you use the money in your account for medical expenses, it's tax-free, where the money in your 457 retirement plan is not tax-free. Consider the HSA as a retirement plan for your medical expenses. According to Employee Benefit Research Institute 2019 analysis, for a 90% chance of having enough funds to cover healthcare expenses in retirement, the couple needs just over $300,000 in savings, and this does not take into account the price for long-term care costs. And lastly, don't forget that you can use the Employee Health Center for most urgent care needs, and those costs do not go towards your deductible. Who are enrolled on the city's Florida Blue Health Plan have access to the Employee Health Center. For health coaching, you can schedule Saturday appointments with a certified health coach, which include healthy eating, an exercise coach, stress management, tobacco cessation. As far as radiology, you get priority appointments at Palm Beach Radiology. There are no co-pays. However, you must meet medical necessity. There's no pre-authorization or no pre-certification. All orders must come from Care Here for the radiology services. Speaking of services, you can go to Care Here for cold, flu, and allergy treatments, well woman exams, annual physicals, and school sports physicals. You can also get generic medications, go for acute care, routine lab work, and chronic disease management. Coming soon, and we're hoping by the end of the year, that employees can use other facilities throughout the state at no cost. As far as the wellness activities, you can have an annual health assessment. There is now chair massage therapy on Thursdays, and also there's wellness challenges that include walking challenges as well. If you're not participating in the health savings account, you may want to consider participating in the Medical Flex Spending Account, which is administered by WageWorks. It's easy to use. It works by using pre-tax dollars to cover medical expenses not covered by your insurance. It's a smart, simple way to save money and keep you and your family healthy and protected. You can also use pre-tax dollars to pay for daycare with a dependent care flex spending account. Why participate in the healthcare or dependent care flex spending account? Because you can save an average of $20 to $30 in taxes for every $100 you set aside through your FSA. How it works is before you enroll, you're going to estimate how much to contribute to your healthcare and or your dependent care expense account for the upcoming fiscal year. So you can decide how much to set aside through your FSA. Funds are taken from your paycheck before taxes. You choose when and how to spend the money in your account. WageWorks lets you upload receipts and submit them for payment. How much you save in taxes depends on how much you spend on health care and dependent care expenses each year and on your tax situation. You always want to underestimate your expenses because it is a use it or lose it plan. If you pay to care for your dependents while you're at work, you're going to want to choose a dependent care account, which will pay for most kinds of before and after school care, daycare, preschool programs, nanny services, summer day camps, plus elder care services for qualifying older adults. Now, in the case of a divorce, IRS guidelines state that a child is a qualified dependent of the custodial parent. Only the custodial parent may participate in the dependent care FSA. A divorced non-custodial parent cannot be reimbursed under a dependent care FSA, even if the divorced parent claims the child as a tax dependent. The city's dental insurance is provided through Emeritus at no cost for the employee or for family coverage. The eligibility requirements are the dependents must be unmarried. They can have coverage through the end of the year in which they reach the age of 20. After the age of 20, they can still have coverage up to the age of 26 if the dependent is dependent upon the employee for support and lives in your household or is a full or part-time student. So here's a brief summary of the dental insurance. It is a PPO plan, which means you can go in network and out of network. Don't forget, whenever you go out of network, the dental provider does not have an agreement with the company, with Emeritus, so they could charge you whatever they want and you would be balanced billed for anything above reasonable customary. So again, it's better to stay in network. So the deductible is $50 for type 2 and type 3. That's your basic and your major. Type 1 is your preventative, and that's your cleanings. They are paid at 100%, and they do need to be every 6 months. So cleanings can not be 5 months and 27 days apart. They do need to be at least 6 months apart. So type 2 is your basic, and that's your filling, your endodontics, periodontics, and crown repair. After you've paid the $50 deductible, you're responsible for 20% of the bill. Type 3 is your major. You would be responsible for 40% of the bill after the $50 deductible, and that's for your crowns, your onlays, and your prosthodontics. The maximum per plan year, so from October 1st through September 30th, is $1,500 that the dental provider carrier will pay on your behalf. So it's $1,500. After that, everything else is out of your pocket. And orthodontia is covered at 50%, only up to $1,500, and that's for children under the age of 19. If you learn that you need an expensive dental procedure, you can always ask your dentist to provide an estimate. There is an online service where you can find out the average cost per procedure in your area. To do this, go on to Emeritus's website and choose the Dental Cost Estimator link. You have coverage for dental emergencies when you're outside of the country. AXA assistance is available in more than 30 countries, with calls being answered 24 hours a day. You'll receive a referral to a provider and will receive a follow-up call within 48 hours after your appointment. Claim forms can then be submitted to Emeritus for consideration. The city offers a vision plan through Superior Vision, with employee premiums guaranteed through September 2022. When you enroll in this plan, you will receive an ID card and a benefits summary. All of your copays, frequency of how often you can use the benefits, and allowance information is listed here. The Vision plan comes with some great discounts, such as 20% off allowance overages for lens add-ons like scratch coating or UV protection, and 10% off of disposable contacts. You also get discounts on an extra pair of glasses or contacts and discounts on LASIK. The city offers life insurance and long-term disability insurance through the standard. The city provides you with a basic life insurance benefit at no cost. The benefit is 2 times the employee's salary up to $100,000 of basic life insurance with a matching AD&D benefit. The basic life insurance also provides a $5,000 benefit on your spouse and your children. There is a line of duty benefit for police officers and firefighters, which is up to an additional $50,000 of life insurance. The beneficiary information should be updated any time of the year. You can apply for additional life insurance by completing a medical history statement. Additional life insurance cannot exceed 5 times your annual salary with a maximum of $300,000 of additional life. You can get additional life on your spouse and your children providing you elected this benefit. The maximum spousal coverage is 50% of what you elect, and the insurance benefit for your children is either a $5,000 or a $10,000 benefit. The cost for both you and your spouse is age-based. Short-term disability is a self-insured city-provided benefit, so it's not provided through the standard. The short-term disability program covers employees for non-work-related illnesses or injuries and pays up to 60% of your current salary. There is a 7-day waiting period for general and SEIU employees and a 14-day waiting period for police PBA and fire IAFF employees. The benefit is paid for up to 26 weeks, and there are claim forms that are needed to apply for this benefit, and you would get that from your HR representative. Long-term disability is provided through the standard. It is provided at no cost to general and SEIU employees. The LTD benefit pays a portion of your gross monthly earnings if you become disabled due to a non-work-related illness or injury. You would receive 60% of your monthly earnings up to $5,000 per month. Long-term disability starts at 6 months of being out of work, right after short-term disability stops. Law enforcement and firefighters can purchase voluntary long-term disability insurance and will receive 60% of their monthly earnings up to $1,500 per month. This benefit would begin after a 180-day waiting period and has a maximum benefit period of 2 years. Please contact HR if you would like to apply for this benefit, as you will be required to fill out a medical history statement. Upon review of your application, you will be notified of your eligibility. You, your spouse, and your children through age of 25 are automatically covered in the Standard's free travel assistance program. Brochures are available on the HR benefits page of the intranet. You receive medical assistance and emergency travel assistance when you're more than 100 miles away from home. There are supplemental insurance policies that you can enroll in that are offered through AFLAC. There's an accident policy, 2 cancer policies, and 2 hospital policies. In order to enroll in the policies, you do need to meet with the AFLAC rep, who will be here on August the 20th, 21st, and 22nd from 9 to noon in the Courtyard Conference Room. I also want to remind you that the city has a great employee assistance program which is offered through Health Advocate. The EAP experts provide confidential assistance with personal issues 24/7, and they can consult with you in person, by telephone, or secure video. This service is available to you, your spouse, and your dependent children. You receive 6 visits per issue per person per year at no cost, and it's completely confidential. You will receive help with stress, anxiety, depression, and family problems. They support you with grief and loss, anger, and substance abuse issues. You can find local services on their comprehensive website to help offer and make your life easier. Additional work-life support is provided for legal or financial issues, creating a will, budgeting, childcare, adoption, or parenting concerns. The Health Advocate website offers great articles and webinars. The only other time you can make changes is when you experience a qualifying event. This allows you to add or remove your dependent on your current plans as long as you make Human Resources aware within 30 days of the event. A qualifying event doesn't allow you to change plans, such as going from an HMO to a PPO, or to add or remove plans. Those types of changes are made during open enrollment. So in closing, open enrollment elections must be made between August the 12th and August the 26th. All changes are made online using employee self-services, and that can be done from any computer, any time of day. Elections must be made by August the 26th. If you would like to make any AFLAC changes, you do need to meet with the AFLAC rep, who will be here certain days in August in the Courtyard Conference Room. Again, as a reminder, you are always required to enroll or re-enroll in the Flex Spending Plan every plan year during open enrollment. And please don't forget to review your October 4th paycheck for any deduction changes.